Hello followers, so today I would like to start a series to talk about the knee problems and knee pain and how to fix it. Um, our first installment today, I would like to go over how to properly descend stairs. So going downstairs without pain. This is a pretty common problem that can happen with a lot of various knee conditions like iliotibial band syndrome, knee arthritis, meniscal problem, amongst other things. And it is not something that you have to suffer with. Most of the time, the problem comes from the mechanic of what's happening at the knee. And actually, it actually comes from either the ankle or the hip. The hip joint and the ankle joint are what direct the knee on which way to move and how to move. And very often, with going downstairs, for example, the problem comes very often from the hip, and a weak hip will lead to pain in the knee because your femur is not held stable, and that creates some extra forces at the knee, and that will irritate various structure, and very often over time lead to arthritis. So I'm going to demonstrate what generally happens when people go downstairs with weak hip, and I will show you a fix. And in another video, I will go in more particular details as to how to build muscle in the gluteus medius, which is in your hip, and one of the main problem when you go downstairs in order to stabilize the knee. So here we go. So I hope you can see here. So I'm going to go down. So very often when people have knee pain is because their femur, this bone right here, falls inward like this. So a lot of people end up doing this. A lot of people end up also going sideways to prevent doing this. The other problem is also sometimes people actually go excessively outward. So that depends on the anatomy of your knee. So very often with valgus, it's because the muscle here, your gluteus medius, is not holding your femur well enough over your foot. So what will happen is this kind of stuff, and if you repeat this often enough with many repetition, that will lead to trouble in the knee. So one way to correct this is depending on the length of your step. If your step is long enough to cover your whole foot, you can certainly keep it right on the step. Sometimes the stairs are not are a little either too long. This one is a little too long actually, so I'll bring my foot just slightly forward so my toes are barely off there, just the tip of my toes. And what I'm going to do is I am going to follow a line that bisects my foot right there with my knee. So what you want to do is keep your knee right over that line and see how I am able to come down with keeping that knee straight right over my foot. I am not collapsing inward or outward, and for me it's fairly easy here. So just like this. Make sure also that you use this leg to guide you down. You are not reaching out with the other leg. What will happen with this is it will very often create twisting and other strain on the other part of the body. So you certainly do not want to do this. So make sure this leg stays up and you're just bending the knee. So this would actually be a very good exercise to practice. Of course, at first, if you do have pain with even just a small range like this, you might have to start even on level ground and just start in a very small range in order and to build tolerance and endurance of the muscle and for this to not hurt.